Soft tissue surgery, again, has to do with this idea that occasionally we have gums that recede, meaning the soft tissues kind of run away from the crowns of the teeth. And so you start to have exposure of the root structure. And roots don't have any enamel on them, and so they're very prone to decay. And once you lose a certain amount of the soft tissue, those teeth become much more susceptible to infections. There are a lot of different soft tissue surgeries available to restore essentially the coverage of the roots and also to restore the aesthetics of the mouth. Because if you think of the teeth as the picture, the soft tissues are the frame. And so you may have seen people where they have one tooth that's much longer than another. Well, that's just because they've had recession. But generally, there's two types of soft tissue surgery. Those that harvest tissue from your palate, and those that harvest tissue either from a human cadaver or an animal cadaver. So the length of a surgery for soft tissue, of course, depends upon how big of a site that you have to address. For a 1 or 2 tooth type of area, might be an hour and a half. If it were a whole quadrant, it could be 3.5 hours. And so it really just varies depending upon the needs of the patient. Anybody who has lost attached gingiva around their teeth to the point that it is either going to make them susceptible to root decay or susceptible to infections around their teeth, they are candidates for soft tissue grafting. And that's a lot of people, by the way. So in terms of soft tissue care and in terms of really good outcomes, I think the thing that really sets us apart, again, is this idea of helping patients make good decisions. We do a great job of educating our patients about what their options are and what the pros and cons are. The second thing is, when it comes to execution, I schedule more than enough time to do whatever it is I need to do. I am never rushed. I will always, 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 always have in mind, what would I do if this were me? Or as I call it, the Whittam question. What would I do if it were me? And if I can answer that question honestly, I can usually execute at a very high level, barring the patient, doing something silly like not following post-op instructions. We have great outcomes for soft tissue surgery and really for pretty much everything we do.